It's Dr. Eric Potter again from Sanctuary Functional Medicine. I'm a functional MD who twice a month is going to be spending time talking about different health topics. They all in some way relate to mold, but we'll also be touching on a number of other subjects along the way. Today will be about Epstein Barr virus, EBV, or also known as mono. So we're going to spend some time and then do some question and answers, which can be a little open-ended in terms of mold or other issues, but mostly focusing on Epstein Barr. So if you're joining us for the first time, do know that we are not going to be diagnosing or advising direct medical treatment for you or anyone that may listen to this later. That is only appropriate in a setting one-on-one with your doctor. If you want us to help, we're glad to do so. Stephen can take your call, 615-815-5941, to learn about what kind of programs we offer. But before you implement anything, please talk to your doctor that is caring for you to make sure that this is right for you. So with that in mind today, again, we're going to talk about Epstein Barr. Epstein Barr virus and how it could be affecting your health. With that, hold on one second. I have one technical difficulty that I forgot to hook up in the midst of everything else. If you give me one moment. Okay, we're good to go again. So, why treat Epstein Barr in the first place? Well, there's a lot of symptoms that Epstein Barr, that virus, the little pesky virus, can cause in patients. We see a lot with chronic fatigue. There are a number of studies that are linking Epstein Barr to chronic fatigue syndrome. Now, it is not the only cause of chronic fatigue syndrome, but it's one of the bigger ones. Also, if someone's experiencing intermittent lymphadenopathy, lymph nodes, or commonly known as glands swollen around your neck, under the arms, if your liver is a little congested, sometimes because liver enzymes, ALT or AST, are elevated. So that may be a cause to check for Epstein Barr. That's because Epstein Barr lives in the B lymphocytes, part of your immune system. This may be fluctuating gland swollen. It can be often associated with fatigue. Also, if a patient has autoimmune disease, it can be a trigger for autoimmune disease, including lupus. There are some links with it potentially interacting with multiple sclerosis. Definitely Hashimoto's thyroiditis causing hypothyroid, and also rheumatoid arthritis. So well, how could that be? How could a virus cause an autoimmune disease? The molecular mimicry, that's basically when your body, your immune system is attacking a virus or another bacteria or some other organism that's invading. And because it looks a little similar to a protein that you have already in your body elsewhere, your body starts reacting and attacking your own tissues. It can be the bystander attack, meaning if you've got a virus that infects a cell, your body starts attacking the virus. Just because the cell is containing it, sometimes it gets caught in the crossfire, and then the immune system continues to attack even after the virus is gone. It can be just pure immune dysregulation when you have Epstein Barr and it is altering your adrenal axis where you're not controlling infections, inflammation, your immune system gets dysregulated, or by toxins such as mold toxin, which we'll talk about a little bit later. It can cause you to attack things in your body that you normally should not. Now, those are the main things that we look for in patients to be concerned about Epstein Barr. There are a few rare cancers, types of lymphoma. We're not going to be talking about those today, but I have seen one patient who did have an Epstein Barr triggered cancer who did pass away from that. So it is something that does happen, but it is very rare. The chronic fatigue, the autoimmune, those are much more common. And intermittently we'll have the waxing and waning intermittent lymphadenopathy. Now, the other reason, about 90% estimated by several sources, are exposed at some point and have had Epstein Barr infection. We do occasionally test and find that some patients have never been exposed to it, but we'll say that's a relatively uncommon occurrence. So what is this Epstein Barr virus that can cause all these yucky symptoms and make you feel bad, put you at risk for even life-threatening issues, or at least morbidities like autoimmune diseases like rheumatoid arthritis or Hashimoto's and lupus. Well, it's a virus. It's in the herpes family of viruses. So it's not just the herpes that you think of in terms of fever blisters or genital warts, genital herpes. It is also HHV6, human herpes virus 6 and 7. There's some other ones in that class that affect humans. Varicella zoster, also known as chickenpox, which then can revisit as shingles. Measles is in that family. Cytomegalovirus, also known as CMV. All these viruses are a specific class, a specific family of viruses, which have a lot of similar characteristics in both in how they replicate and how they infect, but they also infect different parts of our body. Some skin, some nerves, some liver, some more in the brain, some more in other body symptoms, some in the immune system. So with that, we can use their commonalities to think about treatment and diagnosis, and the fact that, for example, chickenpox. You can have chickenpox when you're young, and you can have that recur 50, 60 years later if your immune system gets suppressed. That chickenpox varicella virus has been hiding out in nerves. It comes back out and can cause shingles in a stripe. You can have recurrences of Epstein Barr as well. That's partly what we're going to be talking about, where it's hiding out in the immune system. Something dysregulates the immune system, and suddenly this comes back alive. You have fever blisters can come and go. When you have stress, it lowers your immune system and causes you to have fever blisters that can be quite painful. Now, most people know of Epstein Barr as the cause of mono. That is typically called the kissing disease. It's teenagers and the young ones who are kissing, who are spread that in saliva, which is typically where the virus is found, going from one person to another. But it can also be from sharing cups. It can be smoking cigarettes, passing one, or vaping, and sharing that saliva to the other person. So make sure you're not doing those, swapping spit in various ways other than kissing. Can be ways that you get that. It attacks the immune system once it gets into your body. It multiplies acutely in the short run in lymphocytes. So lymphocytes, which are some of the main cells, mainly B cells that are in your immune system that produce antibodies, hides out in there. As you know, mono will give you the fever, aches, fatigue, flu-like symptoms, viral syndrome. May last a week or two. Sometimes even that acute episode can last several weeks. Some people have a few months of the fatigue that just drags on and on. Long term, it hides out. It goes latent. Latency just means that it is not replicating. It will hide out in an inactive kind of shutdown form, but doesn't completely go away. So that you may, again, like chickenpox or herpes viruses, they may come back years later. Now, conventional medicine kind of thinks it only occurs once and only rarely in triggering maybe some of those rare cancers to come back. Although if you look in the literature, there's a lot of studies that link it and its recurrence with other things like we talked about in the beginning. So in reality, it can recur anytime the immune system is stimulated to wake up those B cells and start replicating, or when it's weakened. So it can also recur with actually overmethylation, which is something we deal a lot with in terms of helping patients balance their B12, their folates, and their methylation cycle. But if you actually overmethylate that which is holding in the Epstein Barr, it can actually cause it to wake up again. So another reason why we like to balance things with methylation and not underdo nor overdo. When you have a recurrence, you can have some lymph node swelling. It could be some sore throats, kind of the tonsils feel a little swollen. But really, for the most part, it's a lot of fatigue. People feel like they are just completely wiped out and exhausted and can't really figure out why. They don't have a fever, they don't have other symptoms, but they feel like a flu fatigue has gone on for months and months, and sometimes even years. May wax and wane a little bit, but it's almost always there. And again, if someone has autoimmune disease, we want to think about that as well as potential trigger. If we can get rid of it, potentially we can help that autoimmune disease get better or resolve. Now, as I said before, we try to make all these things connected with mold. So mold simply suppresses the immune system. When you get mycotoxins, which are released as kind of fumes or gases from these fungi, these molds that live in a water-damaged building. Those things float up, they get in our immune system and into our bodies, mainly most likely by inhalation, although there's some question topically through the skin or foodborne as well are possibilities. But it gets into our body. For those 1 in 4 who have HLA genetics where they cannot get rid of those toxins that can build up, the immune system and our innate immune system is altered. So the innate is what recognizes bad guy versus good guy. Doesn't care what the bad guy's name is. It's going to attack it when it recognizes something is not self, meaning an invader from the outside. It's going to attack. So this upregulates that immune system for the innate and starts activating it, but that turns down, shifts away things that would help attack viruses. So the Th1 arm of the system and often shifts over the Th2, T helper 2, which, as we could talk about another time, triggers a lot of allergies. So part of the immune system is upregulated, part of it's turned down. This mold can often be a trigger for recurrence. Somebody could have had that Epstein Barr perfectly under control, latent completely for years. Mold changes the immune system and suddenly that Epstein Barr starts growing because it finds an open door. So in order to help patients with that, we really do emphasize that we have to get rid of mold, which is leaving the door open, because we can work on the Epstein Barr, but we're not going to ever completely 100% get Epstein Barr out of your body once it's there. So we've got to get your body strong enough so that it can keep its foot on the Epstein Barr's neck and keep it latent rather than active. So how do we treat when we have somebody with Epstein Barr? First of all, we've got to look at lifestyle. We want to make sure that they're having a low or anti-inflammatory diet. If you have inflammation triggering in your body, it is going to hinder your body's ability to heal and hinder your body's ability to fight off infections. That includes a high nutrient diet. A lot of times patients are restricted in their diets, and what we have orthorexia, which means they're eating so well that they have cut out some food group that may, or some vitamin in a certain food group. So we want to make sure they're getting all the nutrients, including phytonutrients that aren't necessarily listed as a vitamin. And we want to make sure that they have a rest and restore pace or rest and restore times in life. Those are the times where you're settled, resting, good sleep patterns, helping your body have time to recuperate. If we're running 100 miles an hour, it's hard for our bodies to stop. And if you're running at 50 miles an hour, you can't recuperate. You've got to let your body have some rest time. And to fight Epstein Barr, we have to do that. Now, there are some pharmaceutical options to consider. We do utilize at least one pharmaceutical option. There are a number of those out there that have been tested. There's mixed reviews on some of the other ones, but we try to use one that is seems to be successful both in terms of literature and in terms of our own experience. We also incorporate mainly a lot of natural therapies. So we use antiviral therapies. Some of those include lysine, it's amino acid, olive leaf extract, garlic, vitamin C can be antiviral. We also want to use pro-immune, things that encourage your immune system to work better. So that can be IV vitamin C, it can be echinacea, licorice can also help making sure someone has adequate vitamin D and adequate vitamin A. Anytime you're dealing with infections, making sure those are sufficient. Otherwise, your immune system will not be as strong. We combine these things over a number of months. This is not something that you treat like a pneumonia that's gone in a week or 10 days. This is something that takes 2, 3, sometimes 6 months to really truly see go away. And sometimes we need longer term suppressive therapy to keep it from coming back again, especially if we are requiring 6 or 12 months to detox someone from mold. It may be a while that they are requiring antiviral therapies. And even then, when we get them better, 1, 2, 3, 4, 5 years down the road, they have another time when their immune system is suppressed. We may have to start over and give them another 1, 2, 4, 6 week course and look for any reason why they may have had their immune system dysregulated again. Make sure we're working on those, kind of repeat that process again. So those detox things can, besides mold toxins, can be mercury, organic toxins, anything that disrupts their immune system. Now, there are some other modalities out there that are mentioned that have been tried. It's not clear that they are beneficial. So anything from T-cell infusions, so another part of your immune system, cells infused stem cell infusions. Steroids are definitely not something you want to use in terms of they actually suppress the immune system and could increase your chance of getting that infection revved up again. So how is Epstein Barr different with mold? Often it's slower and longer therapy. Again, we may have to have some type of Epstein Barr therapy going on for several months, but it's also a clue if somebody's like, yeah, I've treated Epstein Barr several times and it keeps coming back, then we're going to look for mold because that might be the thing that's leaving the door open, and other toxins as well. The symptoms overlap. So I think one of the questions for the question and answer session was just how do you tell the difference between Epstein Barr and mold toxicity? The effects it has, especially when it comes to fatigue or brain fog and so forth. Well, to some degree, you're not always going to know the difference, and you have to treat both and see if someone gets better. I liken it to if you walked into a bar and had 5 people jumping on you and start punching you, you're not going to know if it was Bob, Jack, Jim, or whoever punching you, but you know you're getting punched, and you want to get those off. So if we know Epstein Barr and mold are both there, we're going to look at treating both, or if Lyme is in the mix as well, we're going to be treating those. We might not treat them all at the same time, but we would divide them, sometimes overlapping, sometimes staged, to try to get rid of all of those so that all the guys punching you in the bar fight are gone. And then we say, yep, we're done. We see labs get better, we see symptoms get better, and we know we're on the right track. But again, the big thing, removing those toxins, microtoxins, so the immune system can do its job, and then we don't have to keep helping forever. Now, are there other viruses that can do this? Yes. We will also look at times for C and V, HHV 6 and 7, the human herpes viruses that we can get when we're young. But the herpes family viruses, yes, we'll use overlapping therapies. Again, antiviral, pro-immune. The pharmaceuticals are often very specific to this class, even sometimes within the class, the family, but the natural therapies are very broad-based, so we can see benefit from those regardless of which one of those viruses it is. So that's a good introduction to Epstein Barr. We do treat a number of patients with Epstein Barr here in the office and see success with that. So if you are suffering some of those symptoms, reach out to us and we will help you with that. But for right now, technical again, there we go. Right now, I'm going to take a shift over to the question and answer session. We already have a number of questions that have been submitted online. We'll work through those, but if you want to leave some questions on Facebook, we are still hopefully usually try to get to all of them if possible. If not, we may send those or post those later on Facebook itself. I also want to remind you that there are going to be some references, a bibliography, that if it's not already been posted on the website and linked from Facebook, that gives you some things to read more about Epstein Barr. Some of the things I've talked about already, some of the things I may be answering in questions, just about from autoimmune, different treatment therapies. So if you want to see the research, you know that functional medicine is not just flying by the seat of our pants, but is looking at research. We use both clinical wisdom from others, from that which has been studied, and that which we see effective in patients, using wisdom of just how the body works. God gave us an amazing body that's very complex and interdependent, and as we understand it, and we understand how these natural therapies work, we can see patients get better. So with that, I will also say, remember, not for diagnostic, not for specific individual treatment purposes, but so you can learn, you can be educated, so that you can be empowered to take care of yourself, and you can take steps towards a healthier, more abundant life, which is what our goal for our patients and for those who are receiving information from us in this format. So with that, I'm going to shift over to some questions. Is it always, let's see, are there links between mold toxicity and PTSD? So this is one that's a little off Epstein Barr, but We will talk about that. Don't have the name of the person here handed to me that did ask that, but that's a good question. And that is what we see a lot in patients with mold toxicity is PTSD, post-traumatic stress disorder. Basically, those who have had a very stressful event often will have repeated episodes of either nightmares, flashbacks, panic attacks, ongoing anxiety. They may feel like, really startling easy. They may, if they're in a similar situation, go into complete panic mode. So it can be a very difficult situation to be in. And yes, we see patients, one, who go through mold toxicity often have trauma from getting away from mold itself, but also many of them have been in difficult life situations. I often wonder if it's because their family, who may have abused them growing up, might have been mold toxic as well and caused some of their depression, anxiety, mood disorders that then affected others in the family, particularly the patient who then I'm seeing 20, 30, 40 years later. So mold can set someone up for PTSD. It can also, when you have a traumatic event, the way it affects the limbic system, the part of the autonomic central nervous system where it controls emotions and then interacts with your adrenaline, your vagal nerve, from your parasympathetic, and then the sympathetic nervous system, which gets your adrenaline revved up. When that is affected by mold, it doesn't function very well. You throw some trauma on top of that, and it's a perfect recipe for a disaster of limbic system overdrive, where any little thing can trigger emotional responses, and then your frontal lobes, which help with executive processing, calming yourself down, those are turned off. For example, if somebody came up behind you and startled you, boo, you'd jump, you'd look, you at first would be scared, but then you look, oh, hey, it's my brother, or it's my little sister or something, and then you might be upset with them, but you would turn off the fear response. Someone who has PTSD or mold toxicity and their limbic system, it's the same whether it's in the PTSD purely from just traumatic event without mold, or someone who is mold toxic, it's the same limbic system, the same disruptions occur, just when they are together, it synergizes, and 1 + 1 = 3. That person looks back, sees his little sister, they can't turn the fear off. They may be afraid, like as if it was a bear or somebody was going to mug them. They may be afraid for hours, and they can't turn that emotion off. So yes, the mold toxicity and PTSD often go together. It's one of the reasons why that we often refer patients out to neural retraining. There's some different self-guided ways to do that, courses, and there's also a physician friend who works with patients who work in the military for PTSD and with the police service who've been through traumatic incidences, and helping them has been helpful with a number of our patients to get over that limbic system, turn that down, so then their body can start healing instead of being in the fight or flight, frantic panic mode constantly. So, going to go on. Let's see. If labs show reactivation of Epstein Barr, is it always necessary to treat? Are you always symptomatic with reactivation? Thank you. So, just like anything else, there's varying degrees. I'll answer that second part first. Checking on time, we're good. You can have a mild activation. You may feel okay and a little tired now and then, but not really interfering with life. So maybe it's not a big deal for you. However, as that progresses, that eventually is going to get your immune system stirred up. It's like you've always stirred up immune system like the flu. You're going to always feel a little run down. You're always going to feel like, oh, I'm getting ready to get sick, but not ever quite getting there. So if we see the labs, which we look at a panel that will tell us whether someone has had just a past infection and it's gone, it does not seem to be active, whether somebody's, oh, that infection is in the last 2, 4, 6 weeks, which is a different pattern on those labs, or those labs are elevated, the ones that look like, oh, yes, you did have it in the past. However, your body is fighting as if it sees it right now, and the alarm bells are going off. Those, especially as that number gets higher, we are going to be looking at whether somebody needs treatment. So if they're suffering, they're having fatigue, they're having lymphadenopathy, autoimmune issues, those labs show that, yes, we're going to recommend treatment. Now, we do have those patients who do want to do only natural therapies and want to forego pharmaceuticals, we are willing to do that. I will tell you it's a little faster with a pharmaceutical, but we do see success both ways. So we're willing to work with those who are hesitant with the pharmaceutical side. The next question, Epstein Barr, mold toxicity, and other conditions seem to have some common symptoms. If someone has numerous diagnoses, how to best treat and pinpoint the trigger, then to keep symptoms tamped down and reduce future flare-ups. So I addressed this a little bit, but I want to readdress it just a little different angle. So one, reviewing before, was the fact that if your immune system's suppressed, and you've got a chronic infection like Epstein Barr or Lyme or CMV or other chronic infections, mycoplasma, until we get your body strong enough, we're not going to be able to help your body fight that off. So yes, we can throw an antibiotic or a antiviral or natural or pharmaceutical at that, but even if a conventional doctor is treating pneumonia, if you have this many of the bacteria in your lungs causing pneumonia, a dose of antibiotics kills off this much, then you have this much, then it kills off a portion. So it keeps knocking it down. You always need your body to finish off the last bit. That's why with HIV or AIDS, if you have an immune suppressed, born with immune suppression or develop it from HIV, we can knock it down with antibiotics, but as soon as you pull that out, the support staff is gone and that starts growing back because your immune system can't take care of it. So we'll knock it down, but having to realize that until we get the hometown system, your immune system, working better again, we're not going to be able to keep that down long term. So removing the toxins, removing anything that is hindering your immune system from working, and giving it all the nutrients it needs. If it doesn't have enough iron, if it doesn't have, genetically, you're missing some enzymes that work as well. If there are nutrients that you need to help with those systems, we want to make sure that we're addressing all those and giving you the best optimal chance of recovering from that. And then what do you do to keep it from coming back? Don't get exposed to toxins. Eat the low inflammatory diet. Make sure you have a good rest, exertion balance in your life. If you're working 80, 100 hours a week, you suppress your immune system with stress, you're at risk for those coming back. If you're eating yucky food with low in nutrients, high in inflammation, your immune system's not going to be as strong. If you go back and live in a moldy environment or other toxins, mercury, you're at risk. So we want to help patients not only get over that and have a healthier, more abundant life again, but we want them to keep that healthier, more abundant life and give you the ability to know, oh, here's how I need to stay away from these harmful things and how I keep my body filled with good things. So that's how we're going to approach it, and it's going to be a little different. We do individualized medicine, meaning each person that comes in here is going to be treated a little differently. Yes, we have patterns. Yes, we have some basic protocols, but even if you have 5 patients here with leaky gut, which we've talked about before, each of those 5, they're probably going to have some basic things, but there'll be 1 or 2 things different. Especially one person may need to be off gluten, another person may need dairy, or sometimes I've had patients who reacted with bloody diarrhea to lettuce, which is unusual, and cucumbers. So we will make sure that person is able to get the therapy personalized to them. So we're going to help you empowered, personalized, and keep you healthy rather than letting you fall back into the sickness ditch and having to start over again. Which is one of the reasons we do have our Empowered Life program, where you can maintain a relationship with us, have that access if you have problems down the road, sending portal messages, and also having visits twice a year to make sure we maintain that healthier, more abundant life that you gained through our programs. My labs show an EBV past infection, but nothing active. Can EBV past infection still be affecting my health? Should I be focusing on bringing those numbers down because they are extremely high? So it could be those high numbers for the old infection, the antibodies for the old infection, may be protecting you. So it's not necessarily wanting to bring them down. If the acute reactivation labs are normal, then your body is probably doing a good job and it's unlikely to be affecting you. But it does mean, again, 5 years, 10 years, 20 years down the road, if you're in stress, low nutrients, toxins, not taking care of yourself, that can come back. So we want to make sure that you stay that way, but no, we would not plan active treatment unless there was something where your immune system was weakened by toxicity or deficiency. We might say, oh, we're going to boost that, but it wouldn't necessarily be just because of Epstein Barr, just because we want your immune system to be stronger, for example, making sure you have adequate vitamin D. So a question from Marcia. My grandson has aspiration and has many viruses since birth, with one being Epstein Barr and another being RSV, 4 times already. How is this and mold connected, and how can we clear this from his body? Only 22-month-old, and they have lived in apartments. I'm sure that there has been mold exposure. So I'm sorry to hear about that. I know when you have a child or a grandchild who is sick, it's hard to watch. I have 6 kids, and seeing some of my children go through mold toxicity issues has been very difficult. They are doing better, but it was difficult in the beginning when I started realizing my kids were suffering from some of the same things that my patients were suffering from. So with that, it does sound like there's some immune issues there. Now, mold is not the only thing. Mercury, if they've had vaccinations, can be an issue of suppression. It can be organic toxins if they live near industrial plants, or even lead if parents work in some lead setting, or if you live in a house where there's still lead paint and that child is crawling around and getting dust from lead paint on their hands and licking their hands just because they're kids, can be an issue. So you want to make sure that any toxicity and also any deficiency, if they're not eating a healthy diet, is taken care of. But that does make me wonder, yeah, kids on average are going to get a few colds here and there, but they should not be that bad, and getting RSV 4 times is a little concerning. There's definitely some immune system issues. Whether it's mold, if they've been around it, is definitely a possibility. Now, if you diagnose, you have to diagnose what the reason is, the root cause, as we call it in functional medicine, behind that, and then we try to address that root cause and then clean up the secondary effects, like the viruses and so forth. So there's a number of things. It could be also include going gluten-free. If someone's can be immune suppressed from gluten sensitivity, which mold also can cause more gluten sensitivity as well. Another question from Marcia. Daughter has rheumatoid arthritis, lupus, and ovarian cysts. These connected to Epstein Barr and mold. If so, how can we treat these? So, as I mentioned earlier, yes, there's some autoimmune diseases that there's definitely a dysregulation of how Epstein Barr is handled. There's still some debate on whether it's the chicken or the egg. Is it the autoimmune disease making it easier to have Epstein Barr, or the medicines treating for those autoimmune diseases allowing Epstein Barr to wake up, or is it Epstein Barr that's actually the trigger in the first place? There's definitely some evidence that Epstein Barr is at least playing a part sometimes in that triggering. Again, it's not the only virus that we know does that, but it is one that does it. It has been connected with those diseases: rheumatoid arthritis, lupus, Hashimoto's, multiple sclerosis, which multiple sclerosis is one of the weaker links, but they're investigating it more. So with that, yes, mold can also be connected in terms of any autoimmune disease. We've seen ANA, one of the lupus markers, go away on patients when we detox them for mold. Again, mold is dysregulating the immune system. And I say that not just suppressing, but it turns up the immune system in some ways and turns it down in others. And that's why it's so much problems, because it causes you to attack yourself. And some of those often go away when you detox from mold. And definitely, ovarian cysts, hormonal imbalances, definitely mold will cause hormones to go about as haywire as you can potentially imagine, like walking through a field in a tornado. They will get turned, twisted, shouted, and turned upside down. So we will see some of the craziest hormone imbalances in those patients, and patients get better and have better hormone balance once we get rid of the mold toxins. Another question is, can gastroparesis, refusing to eat, snoring, asthma, and eczema be related to mold issues and possible Epstein Barr? So let's start with mold. Gastroparesis is a condition where the muscles around the stomach slow the squeezing. Normally our gut will push things through, keep kind of squeezing from behind, push food through, Also in the stomach, it's going to churn it up, so it helps digest. With that, if that process stops, food sits there, it can't get pushed further. Patients will get full, they'll lose weight because they're not getting nutrients absorbed. It can cause a lot of reflux because things come backwards instead of going forwards. I do have one patient who is experiencing that, and they do have mold toxicity. Can I say 100% sure that that's what it's from? No, because gastroparesis, that paralysis of sorts of the stomach, can be caused by diabetic neuropathy, other types of nerve injury or nerve toxicities, but I do believe in at least one patient I've cared for, I have seen that connected to that. Refusing to eat kind of plays a part with the gastroparesis. Snoring, if somebody has swollen tonsils, adenoids, which are above the tonsils being below that you can actually see, Epstein Barr coming and going can definitely cause swelling. In that, if the airway is small to begin with, that Epstein Barr, yes, could trigger snoring, which then makes someone have more inflammation because it's like they're choking all night, gagging on their own tonsil lymph tissue, and Epstein Barr lives in that lymph tissue, so absolutely that could be connected. Mold, again, messes with the immune system. Yes, it's going to potentially cause tonsils and adenoids to be a problem. Eczema, it's definitely eczema. It's an related histamine type 2, T helper 2 system of your allergic producing IgE antibodies. The mold will trigger that and cause your mast cells, which release histamine, which then cause allergic inflammation. So definitely patients where we're diagnosing them with mold toxicity, or we actually are treating them, and that while those toxins are coming out, we have to manage their mast cell, whether it's skin issues with eczema and hives, allergy issues with sinuses, gut issues that are also related to histamine. We will manage those with some natural therapies. Rarely have to use some pharmaceuticals, but probably 80-90% of the time we're doing natural therapies and getting patients through that. But so eczema can be, and we'll see a lot of patients do much better as we detoxify them from mold and see eczema improve. But that can also be related to a number of other things, from bacteria and yeast on the skin as well. And the last question was, can EOE, eosinophilic esophagitis, be related to Epstein Barr? So eosinophilic esophagitis is where the number of eosinophils, which release IgE and respond to it, and also can release histamine. So they are very responsive to IgE, and they will trigger the immune allergic response to proceed from there. It's all in the esophagus, so a lot of different foods will trigger those. So mold can trigger that. It's not the most common trigger, but if somebody has that disease, yes, we will look for mold toxicity as one of the potential triggers. So another question from Brenda. Daughter was moved from a moldy apartment January 2nd. This is 2 weeks ago when we retested her urine via real-time labs. Aflatoxin, ochratoxin, trichotillomycin all went down. However, her gliotoxin continues to rise. Thoughts? Thank you. So thank you for that question. So this gets to a testing issue with mold toxicity. Is we typically look for the body's reactions from the immune system, hormone, and some other things in the body, rather than looking for the presence of the toxins in the urine. You can have someone who has the mycotoxins in their urine, but is not reacting. They may be excreting it very well and not having any symptoms, but you may also have someone who's very sick from mold toxicity. When you do their test, it doesn't show much because all of those mycotoxins are trapped. They can't get them out of their body. So for that reason, if we're going to do that, we'll often use a provoked challenge test using some glutathione, which does increase the amount of mycotoxins that's excreted in the urine. But in this case, with having some going down and one going up, without the full story or without seeing what's going on, it could be that there's still an exposure to gliotoxin. It could be that the body's actually doing better and had more gliotoxin there, starting to release some of that, and that's actually coming out more because getting away from it, the body is starting able to get rid of its own. So you may see that. Or if they went on a supplement that increased their detox, their liver, their bile, could be an issue. So the urine tests are a little hard to interpret. You really have to take those in the clinical context. and often it's looking at that over 1 or 2 times of saying repeat that test in 2 to 3 months, which sounds like it's already been done at least once, but 2 weeks between testing, I don't know that I would expect to see a ton of change, because you're going to have some fluctuations just from time to time. What's another question from Terry? What symptoms which I'm experiencing are probably caused by EBV? So I'm not sure which symptoms, since they're not listed here, but with that, again, we're looking at fatigue, autoimmune issues, random lymph node swelling, kind of people who will come in and say, I just feel like I always feel like I'm almost sick, almost got the flu, but then it goes away and just comes and goes. The sore throats that come and go, autoimmune diseases. So those are really the big. Chronic fatigue probably is the biggest, because otherwise you don't see much of Epstein Barr. Whereas if you have shingles or you have a herpes fever blister, you see it. It's easy. It hurts. It's right there. It's all there. With EBV, it's spread throughout your body. You may not feel that unless it happens to be in a lymph node, where you do feel the swelling and the pain. Question from Sherry. Pretty sure my unvaccinated 6-year-old keeps having this recurring mono illness. What can I do to heal him from this? So as I said before, first of all, you always want to make sure you've got the right diagnosis. And you've got all the diagnoses. So a lot of what I explain to patients when I'm sitting there explaining their test results is, if you come to see us, it's typically that you don't have one big problem. You have a series of smaller to medium-sized problems, health issues. If it was just one, usually another doctor will have determined, oh, you've just got thyroid. They give you thyroid, you feel great, all's done, you don't need to come see us. The patients that see us typically say, they treated this, but I never got that much better. They treated this, I never got that much better. They treated this. But they may have been missing this other half. And that's why often mold, gluten sensitivities, mercury toxicity, a lot of different things, chronic infections, Lyme disease. So we will try to find as many of those missing pieces, understand the ones that are already known better, so that when we treat, we're doing 5, 6, 7, 8, 10 different things at a time. So we see that person, oh, wow, everything gets better. It's like if you went into, you had 4 flat tires and you had your car towed in, and the mechanic said, oh, your car's done. You look and one tire's fixed, but the other 3 are still flat. And like, oh, here, go ahead. Here's your keys, drive. What you'd be like, what's going on? I can't drive. It's 3 flat tires. Like, oh, well, I fixed the one. When you come to see a doctor, if you've got four medical issues, fixing one is going to get you a little bit, but we want to get you as far close to that 90 to 100% better as possible. It may take a few months, sometimes longer, especially with mold, but we want to find all those things. So with that in mind, knowing for the 6-year-old what's causing this illness is one, whether it is Epstein Barr, would need testing. That's why we do a number of tests, is to make sure everything, as someone mentioned earlier, the mold and Epstein Barr symptoms often overlap a lot. So we want to make sure we're treating the right thing. We don't want to be shooting at the wrong target. We want to be shooting at the right target, and we want to hit it. All those different targets that someone's experiencing. So it'd be hard to go beyond that for this particular child. One more from before. I had Epstein Barr when I was young, then fibromyalgia really bad, then Lyme 2 times now. I'm just all over the place. So in looking at that, kind of fits in what I said a moment ago, is chronic infections. Lyme can suppress the immune system. So if you're looking for, you don't find mold, Lyme can be another one of those biotoxins, and biotoxins is simply a chemical made by one organism that's toxic or poisonous for another. In this case, Lyme makes toxins, not just an infection, but it creates toxins. Those have been identified. Mold does so. Also, a lot of bacteria. When you hear endotoxins or lipopolysaccharide, those are things that can get out of your gut when somebody's septic. Is triggering a huge overabundant immune activation, and people be septic from that infection in the hospital, and often can die from those. People typically don't die all the time from Lyme, but it is possible. But it is a process where you have that chronic inflammatory low-grade response where your body's never able to heal, so it keeps being inflamed and damaged and damaged and damaged. So we would look for those things. And yes, EBV, mold, Lyme could all contribute to fibromyalgia. So maybe it was never fibromyalgia, which is just a syndrome name. Maybe it was actually Lyme all along. But I'd want to see if all the rocks are turned over in your health story to see if there's anything missing. So I have a few questions here from those who have been listening today. How do we get doctors to believe this is real? So again, I'd mentioned the fact that there are some references in the bibliography. We try to provide that. So when you're talking to your doctor, if you can't come see us, although we do have patients come from even overseas, definitely across the United States, will travel here and see us for that first visit. And then we can see them for up to a year without having another in-person visit. So that is possible. But if you don't have that ability, or you want to try to get your local doctor, you're going to have to bring some research, show them, get them to stop long enough. If they're only seeing you for about 12 to 15 minutes and then moving on to somebody else, and they're doing 50 to 60 hours a week of work, which is common for physicians. If you hand them 20 papers, they may or may not be able to read all of those. They probably won't. But if you hand them one or two and say, hey, would you just look over this, at least glance at this and see what I think I may have this. If you just say, oh, Dr. Google says, yeah, they're good. Their hair on the back of their neck stands up. Not that there's bad information from Dr. Google all the time, but they're going to ignore that. Whereas if you bring a paper from a journal, they're going to be a little bit more open to hearing your story. And then if they still won't listen, I do recommend getting help from someone who will. So from Kathy, thank you for doing this. I'm interested in the B12 methylation. I had mono last year, which I believe was due to overwhelming stress. I've had ongoing fatigue since. Recently been taking high dose B12, B6, methylfolate a couple of months ago, and I've been feeling a bit worse, so this makes sense. So yes, this is something I think it's been in the last 12 to 18 months where there is a connection to overmethylating. Now, overmethylation, you don't have to have Epstein Barr to have symptoms from overmethylation. Anytime we start patients on therapy for MTHFR, which includes methylfolate or folinic acid, or B12, B6, riboflavin, which are other nutrients, and the minerals like magnesium, part of the methylation cycle, is we want to make sure that we don't give them too much. Depending on your genetic SNPs, single nucleotide polymorphisms, you may be at risk for either raising up some neurotransmitter levels, dropping them too low, causing some imbalances. When your methylation, your SAMe, which is a product of the methylation cycle, gets too high, sometimes it can trigger things, so you can get agitation. I'll warn all patients when I'm starting them, low dose and work up. And they'll tell them, if you're agitated, jittery, feel a little revved up, insomnia, funny dreams, teeth grinding, those can all be signs of overmethylation, just being grumpy. If your spouse or your kids are saying, hey, what's wrong with you? You've been a grump lately. It could be that you're actually getting too much, especially if you're looking at methyl B12, methylfolate. If you add something like phosphatidylcholine, which has methyl groups, curcumin can be a mild methyl donor. Theanine, which is a great anti-anxiety therapy, can have some methylation groups. MSM, which is great for joints, is methyl groups that can go in there. Also, some of those things will have a lot of sulfur. And some people will have a little sulfur sensitivity from their methylation cycle because they're also pushing things through glutathione, taurine, cysteine, and making sure you're not getting too much of that. So it is Epstein Barr is one of those pieces of the puzzle. Definitely if I have a Epstein Barr patient, well, I'm really going to always try to avoid overmethylation. I only have a few patients who I get above 5 or even 10,000 of methylfolate a day, or if they're having side effects, I may switch them to folinic, which is often better for the MTHFR 1298 patients for a number of neurotransmitter related reasons. But you want to make sure that you're, again, not overmethylating, whether you've got Epstein Barr or not. And I think I'm going to try to get through a few of these last shorter questions before we wrap up. Patrick, can mold toxicity cause anxiety? Absolutely. Again, it is turning off, in some cases, your frontal lobe's ability to calm down your inner emotions, your visceral emotions like anxiety, depression, fear. So you can definitely have anxiety. Also can rev up your adrenaline, which makes you feel more anxious and edgy. So people will feel like they've always been startled a little bit, or if they get startled, it lasts for hours instead of just a few minutes. So that is definitely one of the things we see, and mood swings with that, to where the anxiety and depression can rapidly fluctuate. From Linda, does a brain scan help in diagnosing these issues? There is something called a neuroquant. It's a test that is slightly difficult to get radiology to do, but it can look at how your brain changes in terms of mold toxicity versus traumatic brain injury versus Lyme disease. It's still being studied, so it's helpful in some cases, but it's also expensive and not often covered by insurance, so it's hard for patients to get those. Epstein Barr, unless you're having an acute infection where you're having meningitis, you would really not see much difference with that. Kathy, do you apply epigenetics in your EBV protocol? I will, if we know someone's genetics, I will consider that. To some degree, like I said before, I'm always going to be trying to avoid overmethylation regardless, but in pure run-of-the-mill, day in, day out Epstein Barr therapy, epigenetics is not as important. It's more of what's going on right now, the functional test of toxicities, nutritional deficiencies, inflammation. And the last one, and this will be it, Kelly, can Epstein Barr and mold cause ASD symptoms? And I'm assuming that's autism spectrum disorder symptoms. So there was a study looking at mold, whether it could cause autism type symptoms. It did not show a correlation, but I also, in that study, even they admit it wasn't a perfect study. So I will say, at the very least, it can sometimes worsen those symptoms. Whether it causes it, I'm not sure the answer is clearly out there. I did a blog post sometime in the last 6 or 12 months. They did note that article, so you can look online and find where that article is on our website and link to it to read that about saying autism is not caused by mold. But definitely, if you have a child with autism who often has GI issues, where they have picky eater, if they have deficiencies, it could make them more likely to suffer from deficiencies and immune system dysfunction that then leads to Epstein Barr. If they have Epstein Barr, it may be worse for them. So not necessarily a chicken and the egg, but some comorbidity, sharing of symptoms and worsening of symptoms, synergizing together. So, all right, we got through everything. I appreciate the fact that everybody joined me today. I enjoy doing these sessions. We will be having more sessions again in 2 more weeks, which the next is April. Computer delay. April the 9th. Nope, sorry, April 11th. That's a Thursday, not a Tuesday. So yes, April 11th, we will be doing Facebook Live again. We will be talking about, I believe, double check this so I don't mislead you at all. On April 11th, we'll be doing Alzheimer's. Alzheimer's and its relationship to mold. And then on April 25th, we'll be talking about mold in your home, how to create a safe home environment when you suffer from mold toxicity. So every other Thursday, unless there's 5 Thursdays in a month, and we do miss that one. But otherwise, we hope these are helpful. If you need our help, Stephen is here in terms of answering questions and how our programs work, helping you get scheduled, 615-815-5941. We have a website that has a lot of other great resources. And all these Facebook Lives, if you missed one of the past ones, are on our Facebook, and you can go back and watch them there. We'll also be getting them eventually over to fully be on YouTube. If you like some of our 1-minute short videos we've done leading up to this each time, those are on YouTube already. So again, blessings. We pray that you are moving towards a healthier, more abundant life. And in some small way, God is using us to be a part of that journey for you. Blessings and have a great day.